Welcome to Speech Language Therapists and Tele-practice Services course prepared by Pakistan Speech Language Therapists Society. It is first part of course named as Introductory Program. Course Objectives: 1. Introduction of basic terms related to speech, language, and tele-practice services. 2. Codes of ethics of tele-practice services. 3. Tele-practice practitioner basics and necessities. 4. Certification types and qualifications as a tele-practice practitioner. 5. Tele-practice technology introduction. 6. Employment in tele-practice. Tele-practice is the use of telecommunications technology to the delivery of therapy, speech-language, psychology, special education, audiology professional services or many more etc., sessions at a distance. Tele-practice serves as a linking bridge to connect clinicians' meetings and to connect client-clinician and clinician-clinician meeting sessions. Session activities may include assessment, intervention, consultation, supervision, mentoring, pre-service, and continuing education etc. There is broad use of services regarding fields. Note: here we will talk about speech-language services and meet UPSB/W client clinicians and clinicians. Tele-practice venues. Tele-practice venues are not limited to discuss but common places include as: Number 1. Educational institutions, more broadly categorized into schools, colleges, and universities. Number 2. Treatment centers, more broadly categorized into medical centers, rehabilitation centers, hospitals, and outpatient clinical setups. Number 3. Residential areas, more broadly categorized into clients' homes, residential healthcare facilities etc. Number 4. Community settings, more broadly categorized into community health centers, child and adult care centers or orphans' homes, or any other corporate setting areas. Types of tele-practice. These are mainly categorized into following 3 types. Number 1. Synchronous type. That is client interactive or live tele-practice type in which services are provided by an interactive audio and or video connection in real time to create an in-person experience. Number 2. Asynchronous type. That is also referred to as store and forward or non-live tele-practice type in which services are provided in the form of images or data are stored first, viewed by a professional, interpretation is done and then transmitted to the target audience. Number 3. Hybrid type. That is a mixed or combination type of tele-practice that uses applications in combinations of synchronous, asynchronous, and or in-person services. Roles and responsibilities of tele-practice practitioners. Number 1. The individuals must have proper and complete understanding about tele-practice technology in terms of conception, theory, and implementation. Number 2. The individuals must have proper training in operations and resolving the technical difficulties of tele-practice technology. Number 3. The individuals must have complete knowledge and usage of clinical instruments and telehealth equipment. Number 4. The individuals must know the procedures about selection of clients, knowledgeable with assessments and interventions suitable for tele-practice. Number 5. The individuals must be properly trained to deal with co-therapists and support personnel like caregiver, team member, parents, siblings, significant others, teacher, other professionals etc. Number 6. The individuals must be skilled in usage and maintaining of documentation such as case history forms, assessment and treatment or other case notes, making of referral notes etc. so as to effectively evaluate the effectiveness of services and received outcome. Number 7. The individuals must be knowledgeable with collaboration effective work. Means do not work solely must be stepped ahead with other professional persons handling the client in any way. Other professional involvement services, advocacy, formation, and creating plans to foster the client's recovery. Number 8. The individuals must be taking refresher courses, training workshops, or courses, conferences time to time to refresh their knowledge and skills, organized by Pakistan Speech Language Therapists Association or other reputed organizations/institutions. Exam and certification procedure. It is divided into two cases. Case 1. 1. Follow dates of announced training course or workshops by Pakistan Speech Language Therapists Association. 2. Properly attend the online or in-person course classes. 3. Theoretical and practical written exams, online or in-person mode. 4. Interview and certificate issued by Pakistan Speech Language Therapists Association, online or in-person mode. Case 2. 1. Submission of copy of certification if you have attended the course other than Pakistan Speech Language Therapists Association, postal, online or in-person mode. 2. Theoretical and practical written exams, online or in-person mode. 3. Interview and certificate issued by Pakistan Speech Language Therapists Association, online or in-person mode. Types of certification for telepractice services. 2 types of certification is issued by Pakistan Speech Language Therapists Association. Type 1 includes teacher, trainer, organization, institution, and clinician. Type 2 is issued on the basis of 1. Language, 2. Culture, 3. or interpreter. Payment rules for telepractice services. Variation found due to nature of location, kind of job practice, area of practice, expertise, experience of service provider. Informed consent must be signed before delivering of services, in which you as a telepractice services provider must inform about nature of treatment procedure and payment method description to your clients. Pakistan Speech Language Therapists Association has also a sample list of suitable payments currently implementing in different regions of country. Measures you need to know when you are to use telepractice services. These are categorized into 3 types. 1. Client variables. 2. Environment variables. 3. Speech-language pathology or practice area. Client variables entails that you have complete insight about demographic data, characteristics of clients and telepractice services, benefits of program to client, and emergent or known challenges client can face during your services. Environment variables entails that you have complete insight about room location, room design, lighting, and furniture type, session material, technology tools to use, and type of support personnel or co-therapist sitting and positioning. You need to know all of these to assist in determining eligibility and making progress towards goals. Speech-language pathology and or practice areas include as 1. Neurological, 2. Articulation, 3. Anatomical, 4. Psychogenic, 5. Fluency, 6. Language and cognitive, 7. Voice, 8. Neurodevelopmental disabilities. Before providing services, it is necessary to know the type of disorder your client has, and you will treat your client if this disorder falls under a practice or specialization criteria. Telepractice technology. Must be trained with use of technical support, video conferencing tools, and know about working and types of cameras and switching and operating of video conferencing modes. Video conferencing tools includes the hardware, software, and peripheral devices that are recording devices and assisting video input equipments. Video conferencing modes are 2 types of modes that are web-based and social network modes. Web-based includes company-preferred software modes regarding institution and business demands like Zoom, Boom, Apple, etc. Social network modes include FaceTime, Skype, WhatsApp, and Google, etc. Types of cameras include digital cameras, laptop, computer, or tablet cameras, document cameras, and mobile phone cameras, etc. Technical issues and resolution. These are technology instruments issues, connectivity, operating and handling issues that can disrupt the service delivery at any time. These are mainly of 2 types. Number 1. Known technical issues. Number 2. Suddenly emergent issues. It is your responsibility to know these issues and how to resolve these at immediate level. If you fail to resolve it at immediate, then you must have some backup or alternative modes of continuation of services. In part 2 of this program you will gain knowledge about these in detail. Employment or profession. Telepractice service delivery is an employment opportunity too. If you want to adopt it as a career choice, then you need to get certification as a trainer from Pakistan Speech Language Therapists Association. As a professional trainer, you need to know the type of training as your practice area of delivery. You should provide quality training to others by meeting all quality standards during your own training. You should know the trainer guidelines made by Pakistan Speech Language Therapists Association as a universal standard that also includes certification characteristics, role, and responsibilities. Education, experience, and expertise qualifications to qualify as a best trainer. Thank you to join us in this journey. Before going to second phase of course, please complete the following steps. 1. Like page Pakistan Speech Language Therapists Association. 2. Like and subscribe YouTube channel, School for Speech and Language Therapy. 3. Submit your feedback of the current course in the comment form on the YouTube channel and on the post published on the Facebook page Pakistan Speech Language Therapists Association. 4. Recommend Facebook page and YouTube channel. Congratulations, you have successfully completed your journey's first step.